Welcome back to Drugs Decode. In today's video, we'll be discussing warfarin, a commonly used oral anticoagulant. We'll cover its mechanism, clinical uses, dosing, drug interactions, side effects, and patient counseling. Let's get started. What is warfarin? Warfarin is an oral anticoagulant that belongs to the class of vitamin K antagonists. It is widely used to prevent and treat thromboembolic disorders such as stroke, deep vein thrombosis, DVT, and pulmonary embolism. Warfarin does not dissolve existing clots, but prevents new clots from forming and stops existing ones from growing. Mechanism of action. Warfarin works by inhibiting the enzyme vitamin K epoxide reductase, which is responsible for recycling vitamin K. Since vitamin K is essential for the production of clotting factors 2, 7, 9, and X, warfarin reduces the blood's ability to clot, preventing thrombosis. However, this also means warfarin requires careful monitoring to balance the risk of bleeding and clotting. Clinical uses of warfarin. Warfarin is commonly prescribed for several conditions, including prevention and treatment of venous thromboembolism, used for deep vein thrombosis, DVT, and pulmonary embolism prevention. Atrial fibrillation reduces the risk of stroke in AF patients. Mechanical heart valves prevents clot formation in patients with prosthetic heart valves. Warfarin dosing and INR monitoring. Warfarin dosing is highly individualized and adjusted based on the International Normalized Ratio, INR. Here are some key points. Standard starting dose, 5 mg daily for most patients. Lower doses, 2 to 3 mg, in elderly, liver disease, or high bleeding risk patients. Dose should be adjusted according to target INR level. Warfarin drug interactions. Warfarin has many drug and food interactions that can either increase or decrease its effect. Drugs that increase warfarin effect, higher bleeding risk. Antibiotics, ciprofloxacin, metronidazole, antifungals, fluconazole, ketoconazole, SSRIs, and antidepressants. Drugs that decrease warfarin effect, higher clotting risk. Anticonvulsants, phenytoin, carbamazepine. Herbal supplements, St. John's wort. Food interactions. High vitamin K foods, spinach, kale, broccoli, reduce warfarin's effect. Side effects and management of overdose. The most serious side effect of warfarin is bleeding. Other rare side effects include purple toe syndrome and skin necrosis. If warfarin overdose occurs, management depends on INR level. Nosebleeds, bruising, bleeding gums are some for sign of warfarin toxicity. Vitamin K, fresh frozen plasma, FFP, and prothrombin complex concentrates are some of the treatment options for the warfarin overdose. Warfarin is contraindicated in pregnancy, can cause birth defects, except in mechanical heart valves, active bleeding disorders, GI bleeding, hemorrhagic stroke, severe liver disease, affects warfarin metabolism, recent major surgery or trauma, increases bleeding risk. Next, counseling points. Pharmacists need to consider these important criteria during the warfarin counseling. Purpose of warfarin is to educate patients on why they are taking warfarin, such as preventing stroke, deep vein thrombosis, DVT, or pulmonary embolism. How to take warfarin. Explain the correct dosing schedule, emphasizing the importance of taking it at the same time every day and not missing doses. Monitoring INR. Patients must regularly check their INR levels to ensure they are within the therapeutic range, preventing both clotting and excessive bleeding. Signs of bleeding. Warn patients about symptoms of excessive anticoagulation, such as easy bruising, nosebleeds, gum bleeding, blood in urine or stools, and prolonged bleeding from cuts. Dietary considerations. Advise patients to maintain a consistent intake of vitamin K-containing foods since sudden changes can affect warfarin's effectiveness. Drug and herbal interactions or inform patients about potential interactions with other medications, including over-the-counter drugs, antibiotics, NSAIDs, and herbal supplements. Alcohol and lifestyle considerations. Caution against excessive alcohol intake, which can affect warfarin metabolism, and discuss the importance of avoiding risky activities that may lead to injuries and bleeding. Managing warfarin overdose. Educate patients on the signs of overdose and the importance of seeking immediate medical help. In severe cases, vitamin K or other reversal agents may be required. Case Study 1. Let's look at a real-world example of warfarin dose adjustment. I will give you a minute to read and understand this question. Patient, Mr. S., 65 years old, on warfarin 5 mg daily for atrial fibrillation. Latest INR is 1.6 is very low. Because they have added a new medication as carbamazepine. Carbamazepine induces CYP enzymes, increasing warfarin metabolism and lowering its effect. So, what should be done? Warfarin dose should be increased by 10 to 15%. INR should be rechecked in 3 to 5 days. And educate patient on drug interactions. Now, let's look at a case of warfarin overdose. I will give you a minute to read and understand these questions. Patient, Ms. P., 72 years old, on warfarin 5 mg daily for DVT. His latest INR is 5.5, which is above the target. Symptoms: nosebleeds, blood in urine. It indicates the warfarin overdose. They have added fluconazole as recent medication. Fluconazole inhibits warfarin metabolism, leading to increased anticoagulation. Reduced vitamin K intake further enhances the effect, increases warfarin effect. What should be done? Hold warfarin for 1 to 2 days. Give vitamin K, 1 to 2 mg orally. Monitor INR daily until stable. To summarize, warfarin is a highly effective anticoagulant but requires careful dosing, INR monitoring, and patient education to minimize bleeding risks. If you found this video helpful, don't forget to like, share, and subscribe to Drugs Decode for more pharmacology content. See you in the next video.